Hello. You've been prescribed imaging from today, and I just wanted you to understand the three different types of imaging that we often do. First, we often prescribe what we call plain X-rays. What do X-rays show? X-rays show simply bones. So if you look at this model of the spine, these are the bones. This is the spinal cord, these are the nerves. So if I took an X-ray of this area, all I'm going to be able to see well are the bones. What I don't see very well are the nerves. And the next point is a CAT scan. And a CAT scan is a very, very, very good X-ray. So just like an X-ray is great at showing bones, a CAT scan is even better at looking and understanding your bony structure. So if you have a broken bone or if you've had surgery before, and I want to understand what is going on with those bones, that's where a CAT scan can really be excellent. The final thing is what we call an MRI. And unlike an X-ray or a CT scan, the MRI is not always the best to look at a bone, but is the best by far to look at a nerve. So if we're trying to see if there's compression on a nerve from a disc herniation or from any other problem in the spine, that's where we will order an MRI. Just a few notes about radiation and these studies. If you are pregnant, obviously you should inform us, and in most cases we will not be prescribing any of these, including even MRI. An MRI, as you may know, has no radiation. An X-ray has a small bit of radiation, and the most radiation is from a CT scan. Overall, however, the amount of radiation that you're receiving from these is extremely small. There's a few other things to understand. It's very important that we at BSNI look at your imaging. We don't want to see simply the report. We want to have the best understanding we can of what's going on. So we want you to bring a CD that has your X-ray, your CT, or your MRI on it. And we want you to bring that every single time you come for your visit, because we want to make sure that we can deliver the best care that's possible. Second, because of the new insurance laws and the way that medicine is being practiced, it's very difficult to obtain an MRI. This can potentially take 1 to 3 weeks to get your approval from your insurance company. We have 1 to 2 people dedicated every single day trying to get these studies done for you as quickly as possible. And sometimes these will be denied. We ask a few things. First, you simply be patient and understand that we are trying to get these studies as quickly as we can. And second, if you don't get these studies performed because they were denied, we will ask you to come back in so that we can try whatever we can in order to get these approved. Thanks, and please don't forget your CDs so we can look at these films together.